It is Medical Monday. If keeping up with your health seems like a full-time job, this new medical model can help make things so much easier. The Modern Heart and Vascular Institute already helps us manage two of the biggest health concerns, heart and vein disease. They also have primary care. Now they've added another specialty, women's health. Dr. Julie Bernell is a gynecologist with the Modern Women's Center. Ladies, it may not be the appointment we love, but just like checking on your heart, your women's exam can also be a lifesaver. Good morning. How are you?
Good. How are you doing?
Good. Okay, so I talk about this modern brand philosophy. Sometimes people, we oftentimes say, if I get sick, I'll go to the hospital. You want to avoid making the hospital visit, right?
Yes, ma'am. That's the last place you want to be.
Yeah. So basically the philosophy is to practice preventive medicine.
Correct.
And you have doctors there with every specialty that we might need. You treat underlying and root causes for best outcomes. All right, gynecology as a whole, just explain what that is.
Well, that's anything to do with women's health. We focus mostly on the reproductive system, everything from puberty to childbearing years to menopause.
Yeah, and when we talk about preventive measures, that's going to be the screening stuff. So different things that you look for, the pelvic exam, for example.
Absolutely. That's, we check everything from outside to, the pap smears for cervical cancer, size of the uterus, ovaries. We also do a very good breast exam on the well woman.
Yeah, all right, so then you know where to go next, all right? Then there's the discussion of symptoms. I think, talking to all of our doctors that we might have to go to, the gynecologist is probably the one that we probably talk to the most, and we feel like, the veil is off, we can tell you anything. But that can lead to, when you have a discussion, lead to finding things that you might want to test further for. For example, ovarian cancer, we know, is sneaky, right? And so when you're talking to a woman, if a woman tells you certain symptoms she's having, what would lead you to think, maybe we should check for this?
We almost check now routinely because ovarian cancer is so hard to pick up. And we usually get at a very late stage. Yeah. So bloating, pelvic pain, just indigestion, back pain, all those are very vague symptoms of ovarian cancer.
Yeah, another thing a lot of women are embarrassed to talk about, pelvic floor issues, which we're hearing more and more people talk about it. So what does that involve?
Well, that's just from, having children and gravity and genetics, things start to fall. And when they do that, most women have the most symptoms with their bladder.
Yeah.
And it's
so you cough, you sneeze, you laugh.
Yeah, it's always fun to go in the grocery store during flu season. Everyone's crossing their legs as they sneeze.
Yeah, well.
So
you're like, I can help you with that, ma'am.
Yeah,
right? Yeah.
But there's a lot of good alternatives for that.
Yeah, and also in conversations, you'll listen for other symptoms. Let's say if somebody has symptoms that may lead to heart disease, the nice thing about where you are is you can say, listen, need you to slide over and see this doctor here, because again, you're all under one umbrella.
Absolutely.
Right.
And heart disease is the number one killer of women, especially once we hit menopause.
Yeah.
Because our hormones are so important to our heart.
Yeah.
So.
And then vein disease, which men deal with as well, but women more so, partly because we're more hormonal, right?
Well, that and babies.
Oh, yeah, those babies do it to us every time. Okay, but you can also check for, there's a primary care physician, which Modern Heart and Vascular has primary care as well. Absolutely. But sometimes the one appointment we will make, as opposed to the primary care one, is our OB. Mm-hmm. And so you can also look at things like if diabetes seems to be present, there's somebody to send you to.
Oh, sure, absolutely. And we do a lot of the screening for them. And then if anything comes up abnormal, we just ship it on over.
Yeah. Discussion of family history. Mm-hmm. I can't tell you how many times I've heard women say, well, I'm not going to get my mammogram because I don't have any family history. Family history is important, but it's not everything.
Correct. They say only 5 to 10% of breast cancers are hereditary. The other 90% are de novo. So yes, mammograms are extremely important.
Yeah, but if someone says, my grandmother, my mother, my aunt, my whatever, you may check for the BRCA gene.
We might. And so a lot of times nowadays, especially if family members had breast cancer, they'll be checked for the BRCA. And if they're negative, then that kind of puts them in the clear.
Yeah.
If they're positive, then we do get them recommended to be checked.
Yeah. Then there's some next steps that would happen there. Okay, at what age should a young lady start checkups with an OB?
Well, for pap smears, we say 21 or sexual activity. If they start having problems with puberty or their menstrual cycles, they can come in as early as 13, 14.
Yeah.
And then we don't recommend them stopping.
Yeah, we don't, so there's not an age to stop. And of course, as we get older, that's when a lot of those serious things become more prevalent, right? They've had time to sit in and set up, if you will.
Correct. And so yes, screening is more important, I think, as we age.
Yeah. All right. And then see something or feel something, say something. Women are notorious. I think human beings, period. Guys do it too. Are notorious for, it's no big deal. It's no big deal. We compensate. But there are little things that can be happening when they start to add up. You got to go in. Better be safe than sorry, right?
Oh, absolutely. Yeah, women write off things because we're too busy. You know, we're taking care of the house, the kids, our husband, a job, and
there's fear. Fear sets in because sometimes,
Yes.
you know, again, how many times someone says, "I don't want to go because I don't want to hear it." When you catch things in earlier stages, we know that the outcomes can be so much better.
Absolutely.
Yeah.
Yeah.
All right. Well, thank you so much for joining us today.
Well,
We were
thank you for
joking
inviting
earlier
me.
in the green room. It's like, you know, we oftentimes hear OB/GYN, right, which is the gynecological and the baby delivering part of it together. But you're like, okay, you're just going to take care of the women because getting up at 3 a.m. out of the blue is it gets tiring. It does,
It's a little
right?
harder, yeah. Definitely for the young OB-GYNs.
Yeah. And I gotta say, I felt so comfortable with you because I was putting. Y'all have no idea where my microphone is on a daily basis. It's in all kinds of places, and usually I hide myself when I'm putting my microphone. She was like, "Yeah, I've seen it before. It doesn't matter." All right. Thank you so much for joining us this morning.
Thank you.
Okay. To schedule an appointment at Modern Women's Center, give them a call at 346-345-4530. Again, that number is 346-345-4530, or visit them online at modernwomencenter.com.